item 36, item 38, item 39, item 40, and item 41.
Move approval of consent items.
Second.
We got a motion and a second. Is there any discussion? Nate, were there any callers on those items that I read?
Not on those items, Judge, just on 12 and 13.
All right, all those in favor of moving those to consent? It passes unanimously. We now are going to move on to our COVID presentation if Dr. Escott is on the line. Is he, Chuck, do you know if he's here?
Judge, he is expected at 10, and I'm looking right now to see if he has joined us early, but I gave him 10 o'clock.
Okay, sounds good. We will move on to the public hearing. Item 1 is a public hearing to receive comments regarding a request to authorize the filing of an instrument to vacate a drainage easement recorded as document number 2014-120671 of the official public records of Travis County and located within Terrace at Walnut Creek, Section 1, a subdivision in Precinct 1. Do I hear a motion to open the public hearing?
Move public hearing be
So
open.
moved.
Thank you. Motion and a second. All those in favor of opening the public hearing, say, raise their hand. Passes unanimously. Are there any members of the public who wish to provide comments on the filing of an instrument to vacate the drainage easement within the Terrace at Walnut Creek? Nate, any callers?
No callers on that item, Judge.
Okay, do I hear a motion to close the public hearing?
So move.
Judge, do we need to get a layout from staff as part of the public hearing?
We could. Staff, are you available to lay that out?
Yes, sir.
Okay.
Good morning. Anna Boland, Travis County TNR. The purpose behind this request is to vacate the drainage easement that's noted, and as an additional drainage easement will be placed that will take the place of the one that we're vacating. The reason for this is due to site constraints and environmental impacts. The existing upstream drainage easement connection point is not usable. So both county staff and city staff have reviewed this request and reviewed the new drainage easement location and document. We find this meets our requirements, and we have no issues with this, and we recommend this, and I know of no objections to this item.
Thank you.
Move to close the public hearing.
Second.
All right, we have a motion and a second. All those in favor? It's closed unanimously. All right, I'm going to bring up item 37. The next item is the action item for today for item 1's public hearing, which is item 37. To consider and take appropriate action on a request to authorize the filing of an instrument to vacate a drainage easement recorded as document number 2014-120671 of the official public records of Travis County and located within Terrace at Walnut Creek, Section 1, a subdivision in Precinct 1. Do I have a motion to approve item 37?
Second.
Move approval of action item 37.
All right, we have a motion and a second. Any discussion? All those in favor? All right, that passes unanimously. Let's see. The next item is item number 4. Consider and take appropriate action regarding outdoor burning in the unincorporated areas of Travis County. Our Fire Marshal, Tony Callaway, is recommending instituting a burning ban for the period of December 15th, 2020 to January 13th, 2021. Mr. Callaway, would you provide an update?
Good morning, Judge, Commissioners. Thank you very much. Our current burn ban is set to expire tomorrow morning. We did receive a little bit of rain, but not nearly enough to assist with the current drought we're experiencing. Our office participated in a call with the National Weather Service looking at long-term forecasts, and it appears we're going to be in a La Nina drought going into the summer. So we're probably not going to have any relief anytime soon. With that said, I do recommend that we put a new burn ban in place effective today that, as the judge stated, would expire on January 13th if action wasn't taken before then.
Thank you. Are there any callers on this item? Nate?
Not on this item, Judge. Thank
Move
you.
approval.
approval of the new burn ban.
Second.
Okay, we have a motion and a second. All those in favor? That burn ban passes unanimously. Thank you, Mr. Callaway. Next is item 17. Ms. Wheeler, are you available?
Good morning, Judge, Commissioners.
Let me call it up real quick. I'm sorry. Next, our Intergovernmental Relations Officer will walk us through item 17 to consider and take action on the joint appointment to the Sobering Center Board of Directors. Ms. Wheeler, will you walk us through this process now? Thank you.
Well, thank you. So, as you all may know, we have a current vacancy for the joint appointment to the Sobering Center. Judge Brown was actually serving in that position until he resigned effective on September 30th of this year. So we typically fill this position in coordination with the City of Austin. However, what our typical process looks like is going to be a little bit different this time. Both entities recently issued their own separate calls to fill positions that they had vacant. And so we both are working with very recent candidate pools. So the suggestion is that rather than issuing a joint call, the city will make a recommendation of one of its candidates that it recently interviewed and send them over to the county to interview. We in turn will take two out of the three candidates remaining from our last interview pool and send those to the city, and they will interview them. This will thus create a candidate pool of no more than 3 candidates total. After that point, the court will do their interviews, the council will do their interviews. If we arrive at a consensus candidate, that would be lovely and wonderful. In the chance that we do not have that happen, the 2 members of the Travis County Health and Human Services Committee will meet with 2 members of the City of Austin Health and Human Services Committee to work on reaching a consensus candidate, similar to what we just did with the central health appointment. See, I'm happy to answer any questions about this process. Again, it's a little bit different from what our typical process is like, but we'll be hopefully streamlining of that process. So again, rather than going through the process of opening a call, waiting 30 days, both entities were lucky to have a number of excellent and well-qualified candidates, many of whom have already been interviewed by both entities.
Thank you, Ms. Wheeler. Commissioners, any questions?
I guess I should be clear. So the first thing would to be to approve this process. And then the second piece is we have 3 candidates that were not selected from the last round of interviews back in September by the court. So I'm asking today for the court to pick, you can pick 1 or you can pick 2 of those 3 candidates, and that is who we will send over to the city to be interviewed.
All right. Does anyone?
Judge,
Yes.
I'll make a motion. First motion is that we approve the process as laid out by Ms. Wheeler.
Okay.
Second.
Second from Trevelyan. Any discussion on that? Nate, are there any callers on these items? Item 17?
Not on this item, Judge. Thank you.
Okay. All those in favor? All right, that passes unanimously.
And my second motion is that we recommend, I guess you won't be formally a judge until January, but Judge-elect Selena Alvarenga as a slot. And I have not had a chance to discuss this with Commissioner Gomez, so I don't know if this is acceptable. But there was discussion about having a judge on the board. And I believe she's the only candidate who will be a judge starting in January.
Commissioners, any further discussion?
Well, I will provide a second for that if I see Commissioner Gomez. I didn't know whether she wanted to provide a second on that. Okay, all right, so I'll provide the second.
Okay. Any further discussion from court members? So it sounds like we've got a motion from Commissioner Shea and a second from Commissioner Trevelyan to move Selena
to recommend her for consideration by the joint group for the joint appointment.
Okay. As stated by Commissioner Shea. All those in favor? And thank you, it passes. I'm going to abstain just because I was not here during the interview process on that one, but sounds like we've got some resolution there. Ms. Wheeler, do you have anything else on this item?
Yes, so I will, as soon as I get information from the city about their candidate, I will work with your office, Judge, to schedule a time for the court to interview that candidate. And just to make it fair, we'll be using the same set of interview questions that we used for the interviews of our candidates. But that won't require a work session because it'll just be one candidate. We can take care of that in a regular voting session.
Okay, thank you.
All right, thank you.
All right, next up is item 18, which is to consider and take appropriate action on the adoption of the Travis County legislative agenda for the regular session of the 87th Texas Legislature. Ms. Wheeler, could you walk us through this item, please?
I will. Thank you all. I'm back so soon after the last item.
Yeah.
So whether or not we like it, session is 27 days away. I was shocked when I was doing the countdown. I knew it was close, but it just feels that much closer now that we're under 30. So what I have for you all today is the legislative agenda to consider. So this will be a living document that represents the policy priorities and principles of the court. There has not been much change from past sessions that we've seen. One of the things that I would like to address with it, if you look at, sorry, the backup came out very late for this and I apologize for that, but under our legislative priorities, we typically have a much longer list because of the challenges that I'm anticipating this session, one with general access to the Capitol, two, just the attention and time that will be spent on COVID this session. We are going to have what I consider a much more conservative agenda. It's going to be focused much more on playing defense than really trying to push many initiatives this session. Typically, we usually have about 10. This session, we will have about 5. That doesn't mean we won't be watching for other legislation that may have an impact to the county. It just means that we will not be the main driver on as many legislative initiatives. So the two that we're adding, that I'm recommending that the court add and make priority this year, the first is to support legislation that would remove the statutory requirement that we accept bids via paper. So currently, we can take bids either electronically or with paper. As we've seen during COVID, it was very difficult to try to accommodate this sort of means where we were running 2 different processes. We had to go virtual. This would allow us to modernize our practices. I have spoken to the purchasing department. We will make available options to help assist people who maybe don't have a computer so that they won't be shut out from the process with this legislative change. And we'll still be able to provide bids electronically with our assistance. The second initiative is one that would impact our Starflight services. So currently we are required to practice balance billing. What that means when somebody has utilized Starflight services, their insurance, if they have it, will cover a certain portion of the cost. They are then left with the remaining balance. As you've seen many times, those come across on court where you have to make a determination whether or not you can collect that debt. We're in a position where we frequently expend more funds and time trying to get money from people for those remaining balances than we ever actually collect. And as you know, Starflight is a wonderful service. We're all grateful that it exists. It's not something that we usually, when we need it, we aren't really consenting to it, but we're happy it's there. So this would allow us to continue to provide those services without having to become essentially debt collectors on those expenses. So those would be the 2 new initiatives that would be seeking legislation for this session. I will pause if there are any questions about those 2 items. If not, I'll continue addressing the changes to the legislative agenda.
So if I could ask a question, Judge?
Yes, Commissioner Trillian.
So does this confirm the expectation that redistricting will be handled in a special session after the initial session, and we won't have a lot of discussions about it or research of that topic during the session?
That is a lovely question. I wish I had a crystal ball and knew. Right now, we are in limbo. So there is an expectation that census data should be delivered to the president by December 31st. That census data in turn gets sent over to Congress at the beginning of the year and then turned over to the states by early April. Right now, where we are with the census is that data, it's clear, one, if we'll meet that deadline. Two, it's unclear if that data will be confirmed as accurate. So normally at this time, redistricting would be on the plate. I am hearing that it's still partially on the plate, if not totally on the plate. So there's the piece where we're waiting to find out what happens with the data. Assuming that everything happens in time, it will be a session focused on redistricting in addition to COVID and the budgetary shortfalls that we know are present. If the data is not received in time, there have been many conversations about whether or not it is possible for the legislature to take that up in a special session. While the Texas Constitution makes it very clear that Texas House and Senate seats must happen in the first regular session in which data was published, there are some other reads on that to believe that they could take it up in a special. As you know, Commissioner, if the legislature does not complete redistricting within the regular session, that process gets moved over to the Legislative Redistricting Board. There are lots of different interpretations right now, and it is very unclear about what will happen. Regardless of what happens at the state level, the county will begin its own redistricting process this summer and complete that in the fall so that you all will be able to run on those new maps with the next election cycle.
And that really was where my question was going. I would like to have some type of project plan that lays out all of the things that we need to consider to make sure that we have access either internally through our county attorney's office or externally through our university network and through the civil rights network, et cetera, so that if it does stay on the agenda, that we're not flat-footed and we don't fall behind because we are flat-footed. I think this is going to be a critical issue moving forward, and I want to make sure that we build the capacity that's necessary to make sure that there is one person and one vote, as opposed to the ideas of others.
Absolutely, Commissioner. And IGR will be bringing forth an item in January to begin discussing the redistricting process for the county. So it is legislation that we'll be following, but we will also be working on our own internal process and working with stakeholders and working with you all on that.
All right. I look forward to working directly with you on that. That is a topic of particular interest.
It's going to be an interesting one this time. I know every decade it seems like that will be the most interesting one, but I think this one might take the cake. So.
Yes. All right. Thank you.
Thank you, Commissioner. Thank you for pointing out redistricting. It will be one of the many elephants in the room this session. Let's see.
Thanks.
Going through again back to. I'm sorry. Were there any other questions?
I was just seeing if there are any other questions for you, Commissioner
No,
Gomez.
I have a question. I just have to just say that CUC is already working on the list of legislation, and they have a list of the bills that have already been filed. And I don't know if you've gotten access to it yet or not. I'll send it to you since we got it. Now, one of the big issues that CUC is talking about is the whole idea where they think that the issue is going to be limiting local government from hiring someone to help with legislation. And we don't want to, we don't know whether to call it a consultant or a lobbyist or whatever, but and we don't know how deep this is going to go as well. But that seems to be the big issue that they're going to stay in touch about. So.
Absolutely, Commissioner. There was a state affairs hearing several weeks ago where that topic was discussed about what sort of input into the process can local governments have, whether that looks like having paid advocacy, in-house staff, or if it even just goes to paying dues for organizations that do hire a lobbyist similar to CUC and TAG. It's something that we're following. There is some traction for it within some of the factions at the legislature. I know that they will want to make some progress on it, but there will also be a host of other issues that they'll be focused on. So I don't think this is going to go away. We'll just have to watch to see how far it does go. It is important to us that we protect our ability to have a say in the process and that we are allowed to have a part in policymaking. You all are elected by your constituents to represent their voices, and it's important that we get to represent those voices at the State House as well.
Okay.
Thank you, Commissioner. So going into the policy positions, again, there's very little update from last session. Most of those changes that you'll see are adding in the 2 new initiatives that we are seeking and strengthening the positions that we've already had in the past. So again, very little change. The biggest change that I wanted to point out within the agenda is under, we have a policy, it's page 8 of the backup, and the item falls underneath our taxation, revenue, budget, and administration positions section. We have had a practice of accepting, this is in response to if we go forward with the electronic bid proposal, we have always made it a practice that if we are going to embrace new technology, that it doesn't subsume previous technology. And so that was a nod to not wanting to shut people out of the process if they didn't have internet access. And so we had to take a look at number 10 and try to make that not be in conflict with the proposal that we're suggesting. So I'll just read that out really quickly to you and explain what that change is. It now says support legislation and budgeting decisions that permit counties to use technology to improve the delivery of information and services to their residents when it's permissive, improves the delivery of information and services, allows the county to continue the delivery of services during times of emergency, and or the new technology is necessary to replace obsolete equipment or practices. I felt it was worth pointing that out to you all because in light of COVID-19, where we have had to make so many of our practices electronic or web-based, it was important that we update the language of our agenda to reflect not only that we need to be able to be responsive in times of emergency, but there are just practical limitations of technology. And sometimes, as much as we would like to maintain those, they do become obsolete, and it's time for us to move to newer modes of technology. I am happy to answer any questions. I know that there are a lot of questions about this upcoming session, what it's going to look like, what our level of engagement will look like. That is all still being worked out. Every day there are new conversations about whether or not the Capitol will be open, if they will come in, pick a new speaker in the House and gavel out for 60 days, if it will be at a standstill. Right now, we are on track with the same number of bills that have been filed in previous sessions. So the number of ideas have not slowed down. Process is to actually get those passed May, however. We will be watching to see what we'll be able to accomplish during the session and whether or not we'll be running this as a normal session or if it'll be a little bit of normal and a little bit of not. But again, until they gavel in on January 12th, we don't really know what that looks like right now. But as always, their most important goal is to pass a budget. It's going to be a tight session. They will have redistricting in some form or fashion on the plate, and COVID-19 will dominate the session. Whether or not we are all tired of hearing about it, it is with us for quite a while.
Thanks. And although there's just two, I think the two bills that you mentioned that we're actually affirmatively trying to get passed, there's also a list of sort of general priorities and things that we would support. So as bills come up that are proposed by others that fall in those categories, those are the bills that we would be supporting as a county. Is that correct, Ms. Wheeler?
Yes, so the legislative agenda is basically what we use essentially as the judgment document for bills and proposals that get filed. And so I use this document that has been vetted through the subcommittee and then approved by the court as the way that the lens that I look at any sort of legislation that gets filed. So if we're going to take action on a bill, either to support or oppose it, I look to see, does it fit within our agenda? Does it fit within our overall guiding principles? Does it meet the test of what we're trying to accomplish with the session? So anything that comes through before we take any sort of action, it really is given deep scrutiny as to whether or not this advances what the court would like to see advanced, or to oppose it if it's going to be in conflict with what the court values for its citizens. And then if we run into any sort of legislation that we're just unclear of how that fits, if it's something that we feel the court needs to take a deeper dive on, those are the type of items that we'll bring to court for further discussion throughout the session. So we can try to anticipate as best we can with the agenda about topics and areas of concern and interest for the court, but there's always going to be something that comes up that we didn't anticipate. Each session sort of has its own flavor, I would say, and they're kind of the topics of that session. And so in sessions past, there was a lot of focus on truancy and juvenile justice reform. So our agenda at that time reflected it. But this session may have a new sort of topic of interest that hasn't risen to that yet and we haven't talked about. And so take this document as a living document that will change. And will morph. It will not look like this at the end of the session as it does today.
Excellent. Thank you. Any further questions, commissioners? All right. Nate, do we have any callers on item 18?
Not on this item, Judge.
All right. Do I hear a motion? Is there a motion to adopt the Travis County legislative agenda?
So moved.
Second.
Okay. Excellent. All those in favor, let's raise your hand. All right. That passes. Thank you, Ms. Wheeler. And we have kept Dr. Escott waiting for a few minutes, so we're going to move on to an update on COVID from Dr. Escott, which I believe is item 3. Travis County's response to and recovery from COVID-19, including but not limited to an update from Dr. Escott or his designee at Austin and Travis County Public Health. Dr. Escott, what is your update?
Thank you, Judge. I'm going to pull up my slides and we'll get started. All right. Thank you, Judge and Commissioners, for the opportunity to update the court on our COVID-19 response. I'm happy to say that today is VA Day. Vaccine has arrived in Austin. Those vaccinations have begun. But it's important for us to realize that this is only the beginning of the end, and there's still a long road to travel until we can declare actual victory over this virus. It's going to take many months of getting folks vaccinated, of our community continuing those protective actions. But this is the beginning of the end, and we should celebrate, but not too much because we've got more work to do. On that note, our update regarding our positive cases detected in Travis County. Yesterday we reported 415 new cases, which brings our moving average to 339. That's a 45% increase since the beginning of the month. So still significant activity, significant transmission, which is widespread community transmission in zip codes across our community. It is simply, once again, everywhere. And we all need to be very careful when we travel outside our house. Again, our recommendations are that folks stay home as much as possible and only go out for essential needs, particularly if they themselves are at high risk or a member of their household is at high risk. We've got to flatten this curve again, and certainly we're seeing the impact from Thanksgiving, and I'll show that in a bit more detail here in the subsequent slides. Our new admissions, yesterday we reported 40 with a moving average of 47. So over the past couple of days, we've seen numbers which are below the moving average. But still, we have a 57% increase in that moving average of admissions since the beginning of this month. And while we've seen improvements in the past couple of days, my expectation is that we will quickly overcome that and we'll continue to advance higher based upon some of the other data that we're seeing. We look at our hospitalization numbers. Again, the blue is our total hospital beds being utilized for COVID-19. The orange are the ICU beds. The gray are the ventilators being utilized. Our hospital beds utilization yesterday was 301, which gives us a moving average of 280, which is a 28% increase since the beginning of the month. ICU beds, 86 in use yesterday, moving average of 85, 13% increase since the beginning of the month. Currently, the state is reporting for trauma service area O, which includes Austin, that around 8.5% of hospital beds are occupied by COVID-19 patients. Their currently available ICU beds are in the neighborhood of 40 to 50 for the entire trauma service area. Now again, we're used to our ICUs operating at near capacity, but there's not a lot of availability right now. We're not at the stage yet of asking our hospitals to scale back on elective procedures because we do have enough cushion there to absorb a bit more. What we're concerned about is 2 or 3 weeks from now and an ongoing aggressive surge increases which may place the sustainability of operations at our hospitals at risk. That's again why we're asking folks to make changes now, to dial back, to decrease their activity outside their house, particularly as we lead up to Christmas and New Year's, so that we can avoid having a repeat of Thanksgiving. What we're seeing here is a result of Thanksgiving interactions. In our discussions with our epidemiology team, there are simply dozens and dozens of examples of entire families being infected based on Thanksgiving holidays in our jurisdiction. Case after case after case of an individual who traveled to another part of the state and other countries, other states in the U.S. That resulted in transmission to the individual and then to their household. It is a concern for us because if we see surge happening now because of Thanksgiving and we see a repeat of that activity during Christmas, we really have the risk of having an El Paso or Lubbock type of substantial and catastrophic surge. So we really do need folks to be more cautious. When we look at the updates from UT's modeling consortium, we can see that the projections over the next several weeks is concerning. They're still modeling. The modeling is still showing that we're expected to exceed that threshold for stage 5 of 50 admissions this week, and quickly passing that 60 mark within the next week or so. So again, these are our projections. This is the projections based on if our disease transmission stays the way it has been. So it's really up to all of us to, again, dial things back, take less risk, and ensure that we can flatten this curve in advance of the holiday. Again, we see similar projections for the ICU numbers. The 200 mark is off the chart here, but again, the projection is that there's about a 25% chance that we'll exceed the 200 capacity before Christmas, but the median projection is in early January for exceeding capacity. So again, this is not not a forecast. This is not what will happen. This is what could happen. This is the most likely scenario if disease transmission stays the way it has been. Judge and Commissioners, this is an update of the active cases by county that I have been showing you. You'll see a dramatic increase happening on the 13th of December. And what happened is the state started adding in probable cases. So the rest of the graph is only indicating positive PCR tests. Starting this weekend, they added the antigen tests, or the probable cases, onto those numbers. So you can see a dramatic increase in the state's numbers, which are in this dark orange. You can see that El Paso and Lubbock are both downtrending now in terms of their active cases. You can see a big jump in Tarrant County, which is this green color, again, likely based upon the addition of those probable cases. But you also see an uptick in Dallas County and further an accelerated increase in San Antonio, Bexar County. Travis County in the dark blue and Harris County, Houston in the yellow are tracking in a very similar pattern, increasing gradually, but no hockey stick appearance yet. Again, we're very concerned that the Christmas holiday may transition into that hockey stick or exponential phase of active case growth, which would put our hospitals in danger. Again, this is an update of the graph of cumulative deaths in Travis County and in the other metro counties around Texas. This is per 100,000 population. Again, you see that Travis County in the bottom is drifting upward towards this 40 mark. With the case activity that we see now, we do expect that by the end of this month, COVID-19 will become the third leading cause of death in Travis County for 2020. We again see more rapid increases in those death numbers in Tarrant County, in Dallas County, and in Bexar County, with things leveling off in El Paso and Lubbock. Now, this is an update of our hospitalizations from last week, and this is based on age. You see that we had a decrease in the percentage of that 70 to 79 age group, which led the age groups last week. Relative flattening of the 80-plus age group in the orange, and an increase in the 60 to 69 age group. I will also point out this yellow line, which is the 20 to 29 age group, had a sharp increase as compared to the previous week. Again, this is related to activities during the Thanksgiving holiday. When we look at our data and the risk for individuals in the 20 to 29 age group for hospitalization, the numbers are very low. So this indicates to us that there is substantial and continued spread in that age group in particular. And I'll talk more about that in just a moment. Again, this is the same data but broken down by numbers of individuals in each age group who were hospitalized. Again, you see a significant increase in the numbers of individuals in the 80-plus age group, moving from 34 to 47. The 70, 79, 52 to 59. A big jump in the 60 to 69 age group, 33 to 55. And similar magnitude of change in the 50 to 59 age group, moving from 25 to 42. And then, of course, our group in yellow, the 20 to 29, moved from 8 hospitalizations the first week of December up to 22 last week. Overall, a significant jump in the individuals hospitalized last week as compared to the previous week, 202 to 278. This is the Thanksgiving effect. This is what we were concerned would happen, and it's in fact happening. We cannot sustain this kind of growth in cases for much longer. We certainly can't sustain this kind of impact post-Christmas. And we again have to work very hard to mitigate the risk so that we don't see similar jumps in cases following Christmas and New Year's. Judge and Commissioner, this is an update of the hospitalizations based on race and ethnicity. Our Latinx population had an increase. That is the line in green. And we also saw a similar increase in our African American community in the gray line. Again, both communities continue to be disproportionately impacted by COVID-19, and that certainly has included the percentage of hospitalizations that they make up week over week. So again, we will continue to focus efforts on these communities, and those communities certainly will be a priority when it comes to vaccination when we are able to offer that on a community-wide basis. This is the same numbers broken down by numbers of individuals hospitalized. Again, the green is our Latinx community moving from 65 to 93 admissions last week. That's a 43% increase in hospitalizations in that group. Similarly, our African American community in the gray color moved from 20 to 31, which is a 55% increase week over week in individuals hospitalized. So again, we need people across our community to wear their mask, to social distance, to wash their hands, to stay home if they're sick, and to avoid those social gatherings. It is about protecting yourself. It's about protecting people you don't know. It's about protecting people who are in our communities of color, our low-income earners, our healthcare workers, our first responders, those folks who have to work, who have to take care of the rest of us. It's a duty that we have to our community, and it's the best way we can defend this community against this virus. The deaths that happen, the severe illness that happens from this day on, is on us as a community. I said yesterday we've started the surrender agreement with this virus. We have vaccines which are rolling out, and we can expect the vaccine to continue to increase in availability over the coming weeks and months. Now's not the time to take risks. Now's not the time to celebrate. Now's the time to buckle down so that we can protect the rest of this community, so that we can prevent needless deaths from a disease that we now have a vaccine for. And we need the community to rally around that and to look after one another as Austin has done all along. Judge and Commissioners, when we look at positivity, unfortunately our positivity rate for last week increased to 9%. This is with almost 19,000 COVID-19 tests back. I'll tell you that the numbers we have in this data set for week 49 are about the same, 18,000, 19,000. So we already have a similar number of results for last week as we do for 2 weeks ago. So this makes me more concerned because we can expect there are going to be several thousand more tests coming, and we already have a positivity rate of 9%. So this is a real effect. We're seeing this despite increasing testing happening. And the data that we're seeing right now that's coming in from the beginning of this week and over the weekend indicates that this number is going to go higher this week. We're not seeing a decrease in cases, a leveling off of cases happening in the next week or 2 weeks, unless we really change things today. So we've got a lot of work to do, and again, we'll continue to report these numbers, continue to encourage folks, if they have any symptoms at all, to get tested. Stay home until you get tested and have a negative result. We need folks who've been exposed to stay home and do what they're supposed to do in quarantine. We need folks to decrease that risk. So not going to have meals with people outside your household, to avoid those social gatherings, and in particular to avoid bars where we see the risk happening. And I'm going to talk more about that on the next slide. This slide is showing that positivity data broken down by race and ethnicity. We've seen from week 49 to week 50 our Latinx positivity go from 13.1% to 16%. African American positivity, 7.2% to 9.4% last week. Our American Indian or Native Alaskan, 8.1% to 13% in week 50. Asian American, a slight decrease, 6.9 to 5.9. And our white non-Hispanic group, 5.4% to 6.8%. Again, every race and ethnicity in our community is above 5%. And we have many of them that are well above 5% and approaching, that 15, 20% range. This is bad. And we're moving in the wrong direction. And I really don't know how to make the message any more clear that what we are doing now as a community is not working, that the precautions people are taking is not working. And I think we all have to take a look at ourselves and say, how can I reduce risk for this community, for myself, for my family? Because, we thought Thanksgiving was bad. This is going to be a memorable Christmas for folks for the wrong reasons. We are going to see unprecedented levels of cases and deaths in this community between now and the end of January if we do not take action right now. So it's really incumbent upon all of us to dig deep, to protect one another, and to ensure that we can keep people alive and safe until we have vaccine available for them. Judge and Commissioners, this is an update of that positivity data based upon age. It really goes without saying that every age category is too high, with the exception of that really young age group. The leading the pack in terms of positivity is our 10 to 19 age group. And we certainly see high rates of positivity in our 40 to 49 age group. We see a similar pattern that we had in week 49 in those two age groups. But we are still seeing about 50% of our cases in this 20 to 29 and 30 to 39 age group. Why is their positivity rates lower? Because they're getting tested more than other age groups. But still 50% of the cases are being seen in those two age groups. Why are those two age groups concerning? Because those are the age groups that are most likely to be frequenting the bars that used to be, they're called restaurants now, but they used to be called bars. Effectively, they're bars that are utilizing a loophole in the state law to allow them to operate. We've seen video after video, photo after photo of these places and people packed together, people dancing face to face without masks on. This is danger. And this is the kind of thing that we need to focus on when we think about how to scale back risk. Those individuals who are 20 to 29, 30 to 39, much lower chance of needing hospitalization and a very, very low chance of dying. But they have a very high chance of spreading disease to other people. And we need them to feel that sense of responsibility, to avoid those bars, to avoid congregating in social settings with people outside their household, so that we can flatten this curve again and save some lives over the next month. That impact that we've seen in cases, in positivity, is spreading to our nursing homes. 180 new cases last week, 302 over the past 28 days. Again, when we see the cases rise in the community, the positivity rise in the community, that impacts those people who are the most vulnerable. About a third of these individuals will die from this. That's the data we have. That's what the state data looks like, what the national data looks like. About 1 in 3 of the people that you see on here that were diagnosed in the past 2 weeks will die from this if they are a resident of a nursing home. It's simply unacceptable. And we've got to continue those efforts. We're close. We can see the light at the end of the tunnel, but we're not there yet. And we really do need folks to consider others. When we look at our update on our schools related cases, 174 new cases last week, 105 in students, 67 in staff, in that other category, the visitors to campus. We also see a substantial impact in terms of quarantine. So about 1,800 individuals under quarantine due to exposure from this group. So it's about 10 or 11 to 1. The other thing that this tells me is that we have to continue to look at opportunities to decrease exposure risk in schools. So we have begun discussing that with our superintendents. The primary concerns related to risk in schools, particularly as we look at the possibility of entering stage 5, are extracurricular activities. By and large, that is where we're seeing disease spread. Extracurricular activities on campus, as well as when those student athletes, dance teams, cheerleaders are practicing outside of the school environment in private gyms. So if we hit stage 5, we're going to ask them to decrease that risk. We're going to ask them to stop extracurricular activities, and if they can't stop them, to significantly scale back. If we get to stage 5, we're going to be in a situation where if the activity can't happen with a mask and with distancing, it probably shouldn't happen until we get ourselves out of that stage 5. So again, some other items related to school. We have some schools that are still have their cafeterias open, where students are sitting face-to-face without masks on. Again, anytime you are without a mask on in front of another individual, that's a risk for exposure. And that is certainly true at the school cafeteria. So we need to look at modifying those kind of activities at schools further to decrease that risk of transmission, and also to impact those individuals who are close contacts and end up needing to be quarantined as a result of that exposure. Judge and Commissioners, this is an update of our influenza activity for the season. Again, very low activity, 2 positive tests for week 49. That's a 0.49% positivity overall, less than 1% positive tests out of more than 3,500. As a result, we are hugging the bottom of this graph, close to 0% week over week, and we can see that's significantly different from every other year over the past 4 years. So we're hopeful that this continues. Again, we start to see the peak of flu season beginning in mid-December and going through to March. So if folks haven't gotten their flu shot, now's the time to get it. Again, we need to continue this effort in relation to flu, particularly as we face limited hospital and ICU capacity potentially in the coming weeks. So again, we appreciate those efforts of folks getting themselves and their families vaccinated. Again, Judge and Commissioners, we're at stage 4. The threshold for stage 5 is over 50. We don't anticipate transition to stage 5 as soon as we hit 50. We generally watch the numbers for at least a few days to ensure that we're going to stay in that range. But depending upon the subsequent days, if we hit 50 on one day and then the next day we're threatening, or 2 days later we're threatening to surpass 60, we may make the decision sooner given that data. Again, my hope is that through our actions today, we can limit the risk of 50 going into stage 5 in advance of Christmas. But it's going to take all of us, this entire community, to scale back the risk and identify how they can decrease the spread through their personal actions. With that, I'll pass it back to you, Judge.
Judge?
Yes, Commissioner Trevelyan.
Once again, I want to thank you for the information that your team has put together and giving us a snapshot and more insight into what's going on in our communities and comparing us to other communities as well. I'm curious, when I was looking at the AISD numbers, do those numbers include the testing results of the 6 sites that were used last week?
The testing that was done would be included in the numbers that we report. So I believe that testing was 2 weeks ago, if I recall correctly.
Okay, so we should have gotten the results from that series of tests, and they should be incorporated in the current numbers.
Correct.
Okay.
43 positives through the student testing, and another 9 in testing that APH did on parents.
Okay. Have we been able to track hotspots so that we know that this zip code area, that zip code area, so that we can identify the Title I schools in those areas?
Yes, Commissioner, that dashboard is available on our COVID-19 website with the zip code specific data.
Okay, I just wanted to make sure that people knew that they could look at the site and look in their area and determine whether they were in a hot spot and where the testing opportunities were in that area. My next question is really going to be about tracking. Once we have identified someone who has been exposed, what are we putting in place to make sure that we are not only addressing their needs, but reaching out to the people that they come in contact with?
So, Commissioner, what happens when a positive test is detected is that our case investigators will call that individual and go through some questions with them, hopefully identify who they may have had close contact with for the 48 hours prior to symptom onset. Unfortunately, what we are seeing quite often now is that people don't want to share that information, which makes the contact tracing impossible. And again, it's critical for us to get that information, get confidential information. When we do get that, our case investigators don't tell the exposures who expose them, but it is important to identify those folks so that we can put them under quarantine, monitor them, and get them tested. But this is how the disease gets out of control when we don't have that widespread community cooperation and the protections and in the data gathering as we try to determine exposures.
I guess what I'm wondering is whether there might be other alternatives. What I mean by that, if we're at Title I schools, even though we might not have the name of the person, whether it's a teacher or whether it's a student or whatever, at least we can know that someone at that school in a particular grade has been impacted, and then people can be notified who are just in that group, as opposed to, I know that some people won't want to share that information, but there's some public places where we get general enough information to at least make people aware that A, the disease has been found at this place, and B, these are the places that you can go for free resources to make sure that you're not impacted.
Commissioner, in relation to schools, our teams at the school districts are the individuals who are doing the close contact assessment and notifying the students and the faculty and staff who've been exposed, and they're doing a great job. The schools are probably our best, are tracking the best right now in this community because they do have things like seating charts and can assess who was within 6 feet of another individual. So we certainly appreciate their partnership. But I want to be clear that that the disease transmission is widespread again in Travis County, and that people can be expected to be exposed anywhere. And again, folks seem to be more concerned about strangers exposing them. That's not how the disease is transmitted. This disease is transmitted between people who know one another or live with one another. And that's why it's important for people to be cautious, regardless of who it is that you're talking to or eating with. They're a risk of spread to you.
Well, listen, I will relinquish the floor just by saying I really appreciate the work that you're doing. I'm really interested in continuing the work of testing on Title I, at Title I schools, and doing what we can to track just to make sure that we, at the school level at least, to make sure that we are keeping kids and communities as safe as we possibly can. Thank you.
Thank you.
Thank you, Commissioner. Commissioner Shea?
Thank you. And of course, Dr. Escott, thank you again for your long hours and your great dedication to our community. Can you please comment some on Dr. Brix's, the national infectious disease expert who's been working with the White House, on her comment that Texas needs to do more to control the outbreak and what kinds of things we could or should be considering? And then I've got another question after that. Sure,
Commissioner. December the 6th, the White House Coronavirus Task Force issued a statement saying that identifying Texas as a hot spot and asking Texas to strengthen its protections. And there were some comments from the state on that. There are some protections in place, and I'm certainly grateful for the governor's mask mandate. I'm grateful for the bar closures and leaving it up to the judge to determine bar opening. But there are huge holes in that protection. We have more than 200 bars that are right now pretending to be restaurants. They're not restaurants. People aren't seated. They're operating as bars. And we have little ability to close those establishments based upon the rules that we have in place right now. The masking exception that we see school districts around the state who, conveniently enough, it happens that the entire student-athlete population has a medical illness that prevents them from wearing a mask when they're participating in activities. I hear from parents of our local basketball players who are upset because their school district, their basketball team requires masks to be worn during basketball games, yet the opposing team has no masks because we don't have the ability to enforce that. We've got some protections in place. Texas was doing well for a while, but we are having unprecedented growth in cases right now. We have more than 8,000 cases, active cases, per 100,000 population in Texas. We're well above the level of we should be concerned about it. Regardless of what we have in place, when we see this unprecedented growth, we have to determine how we can decrease the risk, regardless of what's in place now. And it's really up to all of us. It's up to the state, local governments working together to identify how we can reduce risk so that we can prevent needless death at a time when we have a vaccine that's 95% effective for this virus.
Thank you. Commissioner Shea?
I know that the prioritization for the vaccine is the healthcare providers first, which is as it should be. Many of them have died because of the virus, and we need them to be healthy so they can continue to provide essential healthcare. But do you have an idea of a general timeline for when the vaccine would be available broadly to the general population? And I understand that at the federal level, this administration has not purchased enough. And they just purchased another 100 million, so there'd be a second dose. But that's not enough for the whole population. So do you have any sense for when it could be available for the general population and what the prospect is for there being enough of the vaccines?
So, Commissioner, the data that we have is that the U.S. government has purchased 100 million of the Pfizer vaccine and 200 million of the Moderna vaccine, so enough to vaccinate 150 million people. The challenge with those vaccines is it requires ultra cold storage, which makes it challenging to get out to rural communities and neighborhoods because of the restrictions on who can give it because of the availability of that storage. My guess is that that we'll see the AstraZeneca product, once approved, become the real large vaccine that's purchased because it is easier to store, it's easier to distribute, and I think is more likely to be able to be produced in large enough volumes to get the rest of the country. But the timeline right now is a bit challenging. We just received the first doses yesterday, a very small number. We're expecting the remainder of the 13,650 to arrive by tomorrow, and to start that effort of vaccinating hospital workers. We're expecting Moderna vaccine to start being distributed as early as next week, and to start to add to that. My hope is that by the end of December, we can vaccinate our hospital workers, we can vaccinate EMS, and begin the process of vaccinating our nursing home staff and nursing home residents. Again, it's going to be a gradual process, which needs to be data-driven. And what the data is telling us now is that we have a real workforce shortage in terms of our hospital workers, which is why we're focusing on that group first. Same is true for our EMS and our local fire folks, because there's not a lot of redundancy. When we look at our other goal, prevention of severe disease and death, those are people over the age of 60 primarily. When we look at our data, 81% of the people who've died from COVID-19 in Travis County are 60 years old or older. If we can target those populations, then we take away the risk of overwhelming surge in the hospitals to a substantial extent. If we get down to 50 years old plus, it eliminates about 95% of the deaths that we've experienced in Travis County. So my guess, we're still working with our vaccine coalition on that rollout process. But the indications that we have right now is that it will probably be age-based, and within those age groups, prioritizing individuals who are from communities of color, who are low income, who are essential workers, so that we can continue to also address those individuals who are at higher risk.
Commissioner Shea?
Just a final question. I was really surprised to see the high numbers of infections in the Pflugerville ISD program. It was like 529, and AISD by comparison, which is quite a bit larger, had 115 or something, maybe 150 or so. Do you know why the numbers are so high in the Pflugerville system?
Those numbers were individuals who were quarantined as a result of exposure. And we see some variation in the school districts and how they're determining who they want to protect. In some circumstances, it's only the individuals who were identified as within 6 feet. In some school districts, they do it by classroom. So it's a larger group, and a lot of this has to do with how the community tolerates risk and how protective they want to be. Both versions are acceptable, but certainly it's important to identify those that may have originally been exposed to try to break the chain of transmission.
So does Pflugerville have a larger boundary for quarantine, like a whole classroom versus AISD? You just don't know. There's different factors.
Yeah, I don't know about Pflugerville in particular, but we can certainly have a look and get back to you.
It just seemed like a high number for a smaller school district. And are there particular school districts where all of the athletes have miraculously had a medical reason why they couldn't wear masks?
There are not any school districts locally that I'm aware of. We did have one gym, a private gym, where this happened that impacted one of our high schools. And as a result of that outbreak associated with the gym, I issued a control order that closed the gym temporarily while we worked through mitigating the risk and changing policy associated with that. A significant portion of the individuals practicing the gym had a medical issue or a note from a parent that excused them from wearing a gym or wearing a mask at the gym. The governor's order is very clear. It allows the medical exception. It does not allow a parent to write a note to excuse the wearing of masks. And again, we've got to stop the ridiculousness around the pushback about masks. Masks are not dangerous. Masks are a thin piece of material, a couple of layers or more, that saves people's lives. And the biggest policy mistake that this country has made was creating controversy around masks. It's killed many, many people in this country, and we simply must stop the debate now about the utility of masks.
Thank you. Thanks for that clarification. Finally, have you been able to track the accuracy of the projections from the UT Medical School? Because the rate of increase in that line on their projections is truly alarming. Have they been roughly pretty accurate with their modeling and their projections?
The modeling has been accurate, in the recent assessments of the trajectory. Again, there's lots of variation, and what the models are showing is if behavior stays the same. But unfortunately, the admissions trend has been tracking fairly well. One of the ones that has not been tracking well was the growth in the ICUs, which has been more gradual. And what we did is assess the percentage of hospital beds or hospitalized individuals that end up in the ICU. Early on, it was in the neighborhood of 35 to 40%. So UT and more recently over the fall, it's been about 35%. But what we've seen over the past month or so is that percentage is closer to 30-31%. So they have done some modifications of the projections, the assumptions in the projections for the ICU to take into account a lower percentage of individuals ending up in the ICU.
Thanks so much, Doctor. Those are my questions. Appreciate all you do.
Thank you. Any further? Yes, Commissioner Doherty.
Dr. Escott, is there data that shows if people know that they test positive, that they are more inclined to quarantine or stay away from people? Is there data that we have that can verify that?
We don't have data on that. We have many anecdotes about folks not quarantining when they're supposed to. Even more regarding individuals who are not quarantining between the time they get tested and when they get their result. Regardless of what their symptoms end up being, we need people to stay home until they have that test result back. We need people to get tested frequently if they have symptoms. We have testing available through Austin Public Health, which is free. It's available throughout the community at lots of different sites. So there's really not an excuse now not to get tested. The test is there. The test is free. And the more we can test and detect those cases early, the better chance we have of controlling the spread.
Well, that's the reason I was asking the question, Doc, because so you're telling me that we do have the ability in this community to test everyone that wants to be tested, and could they be tested once a week if they just said, I'm just going to go once a week and I'm going to get tested? I mean, knowing that we can't, that we're not going to get everybody to do that. But if this is a game where you need to really keep people that have this quarantined and away from people, then to me, that would be a huge deal. I mean, my question that I wrote down is, why aren't we promoting weekly tests? And if you find that you test positive, then it is really your responsibility and your obligation to stay away from people, and especially out in the public. So could we test everybody, or would that break the bank, or would that not be practical from your standpoint if we just said we're going to promote everybody to go and on one day of the week go get tested weekly? Could we do that?
So the answer is sort of yes. But it's not everybody needs to be tested every week, but there are individuals where testing on a regular basis, like weekly, would be beneficial. And those who are at the highest risk for transmission, it would also be those who have the highest impact if they're positive and still going to work. So the second example would be, somebody who works in a nursing home. And we've certainly advocated to our nursing home facilities to do that proactive testing on staff. In relation to the community risk, we have met with the UIL and the TEA and recommended proactive testing of student athletes, because that is where we're seeing risk right now. So, if folks are regularly involved in activities where masking or distancing is not done or can't be done, those are the individuals who really do need to consider going once a week and get a test. It's free. It is a minor inconvenience to try to protect this community. So those groups that that fall into that higher risk category in terms of transmission should strongly consider that.
Do you see a time in this community, if we continue down this pathway that is scarily looks like it's possible, to where the hospital said, we cannot take you. We do not, even if we had the beds, we don't have the ability to put the people in touch with you that needs to take care of you. Do you see that could possibly happen in this community?
Yes.
And
I think it's
scary.
going to happen in the next 30 days.
That's the thing that needs to go out on every major network, where people really understand how dire this thing is. Doc, I mean, that I'm not just, a commissioner, but I'm in the private, business world myself. And the most difficult thing that private business people have is, how do you keep your doors open? Because if you can't keep your doors open, not only can you not run your life and take care of your family, you cannot pay your taxes. And we are fixing to come to a period where taxes are due within 60 days. And people are frightened out of their mind. Now, what's going to be interesting is, if you can't pay your taxes, then the city of Austin can't pay their employees, Travis County can't pay their employees. I mean, just take it all the way up to the state or whatever. I mean, we are in a situation where I think most people, let's face it, some people just elect to go out and they just want to have a good time, and they're just blowing all this stuff off because, most people don't die, and most people don't get sick or get real sick. But that's the dilemma that we have. The thing that I have to try to preach to everybody that wants to talk to me about it, and let's face it, all of us elected officials have a lot of people that want to talk to us about it, is I just tell people, I said, this is real, y'all. This is about overwhelming your hospital system to the point to where you just, you know, you run your personnel into the ground where they can't do any more. But somehow we have got to get this point over to people that this is, and let's face it, we're coming up to two of the biggest holidays in the United States anyway. I mean, that being Christmas and New Year's. And if we're upside down right now because of Thanksgiving, I mean, Thanksgiving will look insignificant compared to what Christmas and New Year's is going to deal us. So I'm happy to help and preach it and yell it loudly from the rooftops that, you know, we are heading into a period that you are not going to believe what is going to happen in this community. Because right now, you know, we have this little snapshot with you, you know, every week, and I know that, you know, that council and some other, you know, smaller groups, you know, get to have this brain dump that you give every week, which is fabulous because it really kind of keeps us, you know, at least the elected officials, you know, in the know. But I do not think that the majority of the people in this community understand how dire this thing may get in the next 30 days to where you just needn't come to the hospital because we cannot put you in the hospital and you just have to go home and hopefully weather it and keep from dying. I mean, aren't we kind of at the stage where you would really like to say, I don't know that I'm getting through to y'all. I mean, but aren't you just about there?
Yes. You know, we're close to the stage that if we had the ability to do a lockdown, we would start those discussions. I want to be very clear that a surge like was seen in El Paso would mean another 1,500 Travis County residents dead in the next 60 days. 1,500. You know, to further illustrate the point, right now there are around 500 bodies waiting for a determination of death. 250 or so of those are in mobile morgues because there aren't enough room in hospital morgues and in funeral home morgues to store those bodies. Talking about people sitting in refrigerated trucks because the deaths happen so quickly. We are not immune from that. And we've got to understand, and I know this is a hard sell because it has been a hard sell throughout this pandemic. People aren't sensing right now that things are bad and that hospitals are overwhelmed because they're not. What we're talking about is 2 or 3 weeks from now and trying to prevent that from happening, trying to prevent having to call the state and the federal government to send us hundreds of healthcare workers, to send us trailers so that we can store bodies. We don't want to do that. And we don't have to do that, but it does take us today making those decisions to protect ourselves, protect our community. At the same time, we need to support those local businesses. We need to order takeaway and delivery. If we're going to go out right now, only go out with our families. If we're over 65 or have high-risk medical conditions, stay home. It is finding that balance so that we can survive as a community and buy us time to be able to get that vaccine. We are weeks to months away from being able to vaccinate those people who are at risk. It's just not the time to take that kind of risk.
Then, Doc, I think it's time for elected officials, professionals like you, to sit down with the major media people in this city and get them to understand this is dire. We need 5 o'clock, 6 o'clock, 10 o'clock news dedicated, whether it's 10 or 15 minutes, you know, and just ask them, said, you know, you need to work with us on this because those are, people watch the news. And if they know that they can watch the news and really get this kind of information, I think, I mean, you know, you're frightening me to the point to where I don't mind picking up the phone and calling these major media people and say, it ought to be an obligation and a duty that you all have. I mean, and if somebody's got to get paid for that, okay, fine, then let's find the dollars, I mean, the COVID dollars or whatever, and say, okay, let's pay these media outlets. But we've got to be able to get to the average everyday person on a sustained daily basis, because that's what you have to do to a community. You have to, smack them, several times a day and say, no, I'm not going to let you walk away from here. I mean, you got to listen to this. I mean, it sounds to me like that we are at a stage that if we don't do something like this, then there will be enough people that'll just kind of go on about their merry business, and we will have, these 1,000, 1,500 people numbers like what you're talking about. And I think it's really, really time for us to get serious about coming up with a plan.
I agree, Commissioner. It really does take all of us, people across the community, just to hold on a little bit longer, to work past that COVID fatigue, and to say, not this community. It's not going to happen here, because I'm not going to let it. We can't afford it. We don't have the resources that are going to be available for us that were available for El Paso. Those resources are in Dallas and Fort Worth. They're in Waco, who's experiencing unprecedented surge. It's happening around the state of Texas. I've only shown you the metro jurisdictions, but counties around Texas are facing unprecedented surge right now. My old county, Montgomery County, where I was health authority before I came here, has about 8 times the surge that we're seeing. They're having active cases to similar extent as Lubbock is seeing. It's the story repeats over and over again. We're not doing enough locally. We're not doing enough as a state to stop the spread, and now's the time to take the action.
I'm happy to work with you, Doctor, on trying to get to, key people in this community to get them to understand this.
Thank you.
Judge?
Yep, Commissioner Trillina.
I just want to say, we have been working towards this for months and months and months. We sat down with our school district first thing. We sat down with all of the cities within our jurisdiction first thing. We talked to pastors, we talked to PTAs, we talked to neighborhood associations, we made mask videos. We have been telling everybody that we could for as long as we could. The important thing for us to do, I think, is to work together, because there's some elements in the community that they have taken this and made it a political issue, and ultimately said, masks are, you can't make me. But and what we have been asking for is that, okay, I can't make anybody do anything necessarily, but we can try to protect the folks that will. And that's why when we've had such a response from our Title I schools, because folks understand that this is dangerous, deadly, and they don't have the resources to do what's necessary to protect themselves. And so, I'll sit down and talk to anybody. We're talking to the media, I'll talk to the media. We talk to business community, we'll talk to business community. But some of us have been saying for almost a year that this is serious and people are dying. And a lot of the people that are dying are poor people who have no choice except to work. So, I'll work with you. Let's talk about whoever we need to talk to and wherever we need to talk to them. We'll talk to them anytime and any place. But some of us have been saying this is a huge problem for almost a year. So we want to be a part of the solution, but we have embraced what the problem is. We have followed the science, and we've been trying to protect people the whole time.
Thank you, Commissioner. Commissioners, any other questions or comments for Dr. Escott? Thank you, Dr. Escott. Any final words before you go?
Please be safe out there, and let's echo this message so that folks hear it loud and clear.
Thank you.
Thank you, Judge.
Thank you very much for your work. Chuck, is there any action that we need to take under item 3B today?
Judge, nothing today on item 3B.
Okay. That is Charles Brotherton, our County Executive for Emergency Services, whose voice you always hear at the end there after Dr. Escott. Thank you both for all of your work on this. I know it's constant and a challenge to get the word out, as Commissioner Doherty pointed out, and it sounds like we are all working together in this to let the community know how dire things are, and I appreciate everyone who is working for that. Okay, next we are going to go to item 19. I'm going to call up item 19, which is to consider and take appropriate action on an appointment to the Central Health Board of Managers. And Ms. Wheeler, are you available to walk us through this item?
I am, Judge. Thank you.
Thank you.
So this is our hopefully last appointment item for today.